Well, indeed, a very important day today, the 10th of October, World Mental Health Day, and the global theme, a very important one. And I would imagine this theme was very strategic based on all the different uprisings and war and strife around the world, different conflicts in different parts, and even right here in the region, in our own, sometimes community, we go through that kind of crisis. But of course, there are greater perils going on globally. And the theme, mental health in humanitarian emergencies. A very important one, very important talking point. I want to welcome Director of Mental Health under the umbrella of the Ministry of Health, Dr. Hazel Othello. She's here with us yet again. Every year we get our link up. Great to see you. And your colleague, Dr. Ali Baksh, clinical psychologist with the SWRHA. He's on the Zoom line. Dr. Baksh, good morning to you.
Morning.
Fantastic. Great to see you. We're going to come across to Dr. Baksh in a few. Let me ask you, Dr. Othello. This particular theme, I would imagine, based on what we're looking at globally, many look at the response as it pertains to nutrition and the overall well-being of a particular place. But, you know, I didn't really analyze and yes, it's very important, mental health as it pertains to crisis, post-traumatic stress disorder, and how people treat with trying to get back to a place of normalcy after the bombs and the guns and the killings stop. Could we even unpack this scenario here?
Thank you for the opportunity to share on this topic today. The unfortunate reality is that traditionally the response to humanitarian emergencies with regard to mental health has been an after-the-fact response. And globally, mental health service providers are working to change that. The World Health Organization has a subgroup called Mental Health and Psychosocial Support. And in different countries, there are technical working groups. In Trinidad and Tobago, we started a mental health and psychosocial support technical working group during the pandemic as our response, our mental health response to the pandemic, which was a humanitarian emergency. So that from that time, we began working in that area with more of a focus on, while during the pandemic it was a response, after the pandemic ended, our technical working group, we say TWG for short, our TWG continued meeting monthly so that we could anticipate and plan for future emergencies.
Yeah, indeed. I want to bring it home, and I probably want to bring Dr. Baksh in now to give us some more concerning our own experience, our own perils. I mean, we have seen where many are desensitized to sometimes the violence we see in society. Folks rather sometimes take out their phone and record, or not even render assistance if someone is going through a particular moment. I don't know where we are as a country, Trinidad and Tobago, as it pertains to that reality. Walk us through it and just give us some perspective, Doc.
Okay, so the reality of it is that as a country, we still very much handled with stigma. So people are very less likely to seek support. But we need to move because students observe our loved ones or friends, family, see their behavior, judge it from their normal behavior. So you see an individual who is basically happy, sociable, eating on time, always on food, and then you observe them, you see they're not eating, they always by themselves, they're isolated, sometimes they're crying. Here's when we take the initiative, go up to the individual and say, okay, can do these changes and what's going on? Someone there's someone that you can relate to. So I think in doing that, we have understood a little bit as to what mental health is and how we could prevent mental health illnesses between individuals.
Yeah, thanks a lot, Doc. Let me bring it back to you, Dr. Othello. I want to bring it to our experience here in Trinidad and Tobago, and especially when we look at certain issues somebody might present with bipolar disorder. And while trying to treat with that, we also, many of us as Trinbagonians, based on the Caribbean lifestyle and I guess the culture, people sometimes get to go to substances to suppress. And I could only imagine that could only further send someone into probably a tailspin. What's the conversation like in that regard, and what advice you want to tell folks out there who sometimes go to a substance to suppress what they're feeling or to numb any particular personal peril they're going through?
I would like to tell Trinidad and Tobago that using a substance to cope with a problem is never a solution. You may feel a little better for a little while, but in the long term, the problem is still there, the challenge is still there, and the problem is compounded often by the effects of the substance. And if you become addicted to that substance, that's a whole new set of problems that come into your life, and all the social implications of that. If it's something that's costly to acquire, if it's something that's illegal, if it's something that impairs your judgment or impairs your ability to do what you need to do. So that it's always better to get help, to seek mental health support. And that's why the team is mental health support, getting that support, access to care in emergencies, right? We need to always put the services in place, and that's what we've been doing, ensuring that the services are in place, but we're also trying to do more on the front of making people aware of the services, because you can have the best services in the world if people don't know how to access them. In good times, they would struggle, and in emergencies, it's only going to be worse. So that's why it's so important that people know how to access our services, and that services are easy to reach, right? That's why we have findcareTT.com, so that you could, on your phone, find it easily. We've since developed Teen Care TT, so that young people, because we found Find Care wasn't youth-centered enough. So we collaborated with young people and developed Teen Care TT. And in addition to that, we've also taken note of the fact that young people, they text all day. It's easier for them to text in a challenge than to make a call. That's what they live, that's what they do, that's their life. So we now have You Matter, a text line where young people can access support during those difficult moments and get the help that they need, which includes being redirected to substance abuse support if that's what they need.
How do we, or what advice you want to say to parents or to guardians or anyone who they love a family member or a friend, they want to help out, but the person is not as willing. There is that lack of willingness, as it were, to seek the help. What advice? How do we get someone? Because I guess seeking the help also must also be a personal experience. You must want the help. How do we help people get over the line?
That is so difficult sometimes, and there is no one easy solution, but it's important to support that person from the point of view of letting them know that you care and that you're there for them, and that as soon as they want help, you're going to make sure that they get that help. So you find the resources, you know what is available, you know how to get where the clinic is, how to get there, right? But unfortunately, we can't force them, right? Some people, find themselves in trouble with the law and find themselves pushed as a result of that towards getting help. But we want people to get help before that, and that's why the outreach is so important, right? And from the point of view of service providers, right? Or groups like NADAP, our National Agency for Prevention of Drug Abuse, they do a lot of outreach as well, so that people know what is available, so that when that person is ready, you can jump on it, because it's so difficult.
Multi-pronged, I would imagine.
Yes, it's difficult when that person is not yet ready.
Let me get some perspective here really quick from Dr. Baksh, and I'll let you elaborate some more. The level of frustration we see on a daily basis, Doc, where folks are quick to anger, the kind of road rage, people ready to literally pick up arms when there's a disagreement. I mean, sometimes I wonder if people forget we're on an island. This is the Caribbean. I mean, foreigners think that, we all happy-go-lucky, but the reality of the day is that many people are frustrated, whether it be financial peril, emotional, whatever the case, and you see it and feel it out there. How could we get back to a place of calm, Doc?
So I think the biggest thing is the lack of coping skills and mechanisms that we have. So it's easier, so like if something happens, right, it's easier to do something like that, rather than to actually do the stress that I can. Now, we are living in a society, and as the world evolves, society and stresses are going to continuously increase. So we as individuals now have to adapt and find coping mechanisms deal with stresses that are placed on us on a daily basis. Whether it's in school, whether it's in work, whether it's at home, we need to differentiate between our stressors and how we deal with them accordingly. Now, there'll be positive stressors, there'll be negative stressors. The negative stressors are the ones that will actually overpower us, to act more irritable, angry, to change our entire mood and behavior. Positive stressors will kind of guide us more, push us more to actually get things done. On that note, there are positive and there are negative coping mechanisms. Negative ones are the ones that will suppress the issue for some time and then eventually make it loose. The positive ones are the ones now that we want to engage ourselves in. Engaging ourselves in those, we are able to manage our stress differently, control our behavior, and adapt to things as they come.
Indeed. Thanks a lot there, Doc, because again, we even look at what's happening with the young people. Yes, their minds are developing, so I don't ever judge a youth. Yes, because we have camera phones, lots of what they do now, their bad behavior, it's recorded, so we're able to see it more. But it had fight in my time and it had fight in your time.
That's right.
It always had fights with young people, right? But we're seeing even our girls now getting involved in a very vicious way, and people just are so quick to anger and ready to scramble someone. Is that, I mean, Doc now gave us the science behind it, but the Trinidad and Tobago experience, we all Trinis, we live here. You think with intervention we could turn it around at some point?
Yes, it is important to provide the interventions that those young people need to make sure that when they've begun to behave in that way, there are efforts to assist them. Yes, there has to be some measure of accountability so that they understand that this is not the best path forward. But then they have to learn how to do things differently. They have to learn how to respond differently to situations, right? And that's where the psychological interventions come in, right? The Student Supports Division has, school social workers and psychologists and so on who work with young people. And through the mental health services in the health sector, we also provide some interventions. But it's really important to not give up on young people and to work with them and support them. Because sometimes some of them start off in a really, we've all seen young people start off in a really bad place. And we've seen those who've risen above it and who have lived, really productive lives. So we really have to work with them.
Now, we can never give up on the youth. I always say that here, granted, yes, you hold them accountable if you cross the line, but we can't give up on them at all. As we look to wrap things up, any special plans in place for today? I know the SWRHA, well, Dr. Baksh is there, but in terms of the RHAs, or just generally the Ministry of Health, any major engagements, activations happening today, guys?
Well, it's Paint the Town Green time again. All right. That's our national strategy for World Mental Health Day and for mental health advocacy. Right, and we continue to thank Caroline Othello who brought that idea to us and help us start along that journey. In years past, we've done it in different communities, but now we're taking a more national approach to it.
Nice.
Right, so the ministry has written to all the RHAs and to stakeholders and asked them, everybody can do Paint the Town Green in their neck of the woods, wherever that is. Yeah. So at the ministry, we have some balloon art on every level. Today we have treats for staff, we have karaoke, we have Family Feud and other games, things to help our staff to just enjoy themselves and have some fun together.
Well said. Well, let me thank you, Dr. Baksh, for the perspective this morning. All the best to you and your colleagues at the SWRHA. To you, Dr. Othello, thanks for coming on.
It's always a pleasure.
Yes, and let's keep this conversation of mental health definitely in the public domain. Let's normalize the conversation and let's advance the agenda, as it were, with mental health here in Trinidad and Tobago. Well, keeping with the mental health topic, up next, we get you ready for the mental health beach cleanup. Everybody getting involved. And this is happening tomorrow at Small Boats, the Brandon Gunpad Foundation. They're involved in a major way. Full details after the break.